The CPT, Current Procedural Terminology, Respiratory System section contains guidelines for coding procedures related to the respiratory system. Here are some key guidelines within the CPT Respiratory System section. Diagnostic procedures. 1. Guidelines for reporting diagnostic procedures such as bronchoscopy, lung biopsy, or diagnostic thoracoscopy. 2. Instructions on when to report fluoroscopic guidance, imaging guidance, or biopsy procedures separately. Therapeutic procedures. 1. Guidelines for reporting therapeutic procedures such as bronchial thermoplasty, bronchial stent placement, or bronchial artery embolization. 2. Instructions on reporting codes for bronchoscopy with various therapeutic interventions. Lung and pleura procedures. 1. Guidelines for reporting procedures involving the lung and pleura, such as thoracentesis, pleural biopsy, or lung resection. 2. Instructions on when to report imaging guidance separately and when to report additional procedures performed during the same session. Respiratory treatment services. 1. Guidelines for reporting services related to respiratory treatments, including oxygen therapy, continuous positive airway pressure, CPAP, or mechanical ventilation. 2. Instructions on reporting initiation and management of respiratory treatment services. Respiratory system assessments. 1. Guidelines for reporting respiratory system assessments, such as spirometry, lung capacity tests, or respiratory flow rate measurements. 2. Instructions on coding for specific components of respiratory assessments. Respiratory system monitoring. 1. Guidelines for reporting services related to the monitoring of the respiratory system, such as pulse oximetry or capnography. 2. Instructions on reporting single or multiple determinations and when to report separately from other procedures. Endoscopy and other procedures. 1. Guidelines for reporting endoscopic procedures of the respiratory system, such as bronchial brushing, bronchoalveolar lavage, or foreign body removal. 2. Instructions on reporting separately performed procedures during the same session. Respiratory system surgery. 1. Guidelines for reporting surgical procedures involving the respiratory system, such as lobectomy, pneumonectomy, or tracheostomy. 2. Instructions on reporting additional procedures performed during the same session and guidelines for reporting mediastinal lymphadenectomy. Certainly, here are some guidelines within the CPT Respiratory System section along with corresponding examples. Diagnostic procedures. 1. Example: diagnostic bronchoscopy with transbronchial lung biopsy. 2. Code: CPT code 31622 bronchoscopy, rigid or flexible, including fluoroscopic guidance, when performed, with transbronchial lung biopsies, single lobe. Therapeutic procedures. 1. Example: bronchial thermoplasty for the treatment of asthma. 2. Code: CPT code 31660 bronchoscopy, rigid or flexible, including fluoroscopic guidance, when performed, with bronchial thermoplasty. Lung and pleura procedures. 1. Example: thoracentesis for the removal of pleural fluid. 2. Code: CPT code 32554 thoracentesis, puncture of pleural cavity with insertion of cannula or catheter, e.g., tube, needle, e.g., for diagnostic or therapeutic purposes, with imaging guidance, e.g., fluoroscopic, CT. List separately in addition to code for primary procedure. Respiratory treatment services. 1. Example: management of continuous positive airway pressure, CPAP, for sleep apnea. 2. Code: CPT code 94660 continuous positive airway pressure ventilation, CPAP, initiation and management. Respiratory system assessments. 1. Example: pulmonary function testing to evaluate lung capacity. 2. Code: CPT code 94010 spirometry, including graphic record, total and timed vital capacity, expiratory flow rate measurements, with or without maximal voluntary ventilation. Respiratory system monitoring. 1. Example: overnight pulse oximetry to monitor oxygen saturation levels. 2. Code: CPT code 94762 non-invasive ear or pulse oximetry for oxygen saturation, single determination. Endoscopy and other procedures. 1. Example: flexible bronchoscopy with bronchial brushings. 2. Code: CPT code 31623 bronchoscopy, rigid or flexible, including fluoroscopic guidance, when performed, with brushing or washing, separate procedure. Respiratory system surgery. 1. Example: lobectomy for the removal of a lung lobe. 2. Code: CPT code 32480 lobectomy, with mediastinal lymphadenectomy, including radical pneumonectomy and sleeve lobectomy. List separately in addition to code for primary procedure. It's important to consult the complete CPT manual and review the specific guidelines and instructions within the respiratory system section for accurate coding. Familiarity with these guidelines will help ensure proper coding and documentation for procedures related to the respiratory system.